a real pleasure to have Tim Vukan with us tonight. And Tim Vukan is finishing off our series on long COVID. And without further ado, I will introduce Tim, who is one of only a handful of Westerners to have completed the depth of training that he has. For 15 years, he's been based in Hangzhou in China, where he has completed more than 10 years of study at the Zhejiang TCM University, and has, in his later years, worked as a lecturer at the same university. He also runs his own program, Wushan TCM, running online courses for Westerners in TCM. Now, Tim, thank you very much for being with us. On behalf of the BXC, it's really a great honor to have you. Over to you, Tim.
Thanks a lot. I first want to thanks everyone for joining tonight, for taking the time. And I'm happy to share my slide and then also to give you a short introduction about myself. Ellen was already introducing you the basics about myself, and you can already see the topic today of our lecture is the long COVID treatment and related with acupuncture. So what we can focus on, if we can see the patients in the clinic coming back after being ill, some might also be very seriously ill, and then seeking for an acupuncturist. And we have a lot of content today waiting for you here. In the beginning, I also tell you, I took the reference of the China Association of Acupuncture and Mock Sebastian. So all the content what you will hear tonight is also coming from this institute, and I'm very happy to share this today with you. You already know my name. My name is Tim Vukan. I am German. At the moment, I'm also in the northern part of Germany. I'm in Hamburg. And in 2004, I decided to move to China to start my Chinese medicine education over there. And I had the idea first to learn Chinese language. So this is what I did at the Zhejiang Chinese Medical University, where I started my Mandarin studies. And you can imagine this was quite challenging. But after a year, I was more or less ready to join the undergraduate. And this is what I also did in China. It's a 5-year program, entirely taught in Chinese. And that wasn't all, because I decided to go on, and I also did another hospital year after the undergraduate to prepare for the National Medical License Test. And I also added 3 more years for the master degree program at the same university, which was very interesting. So I took a tutor who was teaching me a lot about Jingfang. So this is more about herbal medicine. Today we talk more about acupuncture, but during these years I had been studying herbal medicine and acupuncture and Tuina massage therapy and many different kind of classes. And now I'm also teaching in that school at Zhejiang Chinese Medical University, teaching mainly Chinese students. And that's sometimes very interesting when a Western person is teaching Chinese people, sometimes in medical English, sometimes also in Chinese medicine lectures. So you can very much see that I'm very much interested in this. And I also created my own network to give Western people the opportunity to receive authentic, professional, and also personal insight from Chinese medicine from Hangzhou, which is a beautiful city which is close to Shanghai. And I'm offering these online courses over there. So during the lecture, please feel always free to ask your questions. You can have Fiona and Alan, who are also helping you to receive these questions. And if it's suitable to the content, if I can answer them immediately, I'm happy to also do that. And otherwise, if we would like to take more time to discuss about it, we also have another 30 minutes at the end. Yes, okay. So in the beginning, you will first see the contents of this live webinar. We start with some main introduction about long COVID. We then go to the differentiation, which is the main part, because in Chinese medicine, we always should differentiate the syndromes, and of course, taking a focus on the recovery period. Followed by acupuncture points, which are mainly used. And then we have different kind of categories. You already see it over here, lung and spleen qi deficiency. The second category is qi and yin deficiency. And we have another one with lung and spleen deficiency, with phlegm and blood stasis blocking the channels. You will also get some information, what you can teach, you can tell to your patients, so some kind of self-applications for them, because it's not only good actually to receive an acupuncture treatment in the clinic, but maybe people are also asking what they can actually do at home. Then there is a special part which comes from the Jin 3 needle technique. It's a special acupuncture technique from Guangzhou, China. The 3 nose needles is one part of it, and I hope this is also helping you further. Starting with the introduction, of course, it's first the question, what are patients actually seeking when they come for a treatment after being ill with COVID, so in the long COVID treatment? I think you also read a lot of things in the news, and we constantly hear that people, they are very fatigued, they're very tired, sometimes having very poor digestion. Sometimes some cough is still there, a lot of dampness and phlegm related symptoms. And Chinese medicine has actually a lot of ways on how to help these patients. So often these patients are a little bit looking for this kind of help, what is not offered sometimes by Western medicine. This is not to criticize Western medicine, but this is to strengthen also the parts of Chinese medicine, because we not only have acupuncture, I mean, this would be our main part today over here, but of course we can also combine, for example, Mox Sebastian, or who knows about herbal medicine, who already has a background, of course, also can prescribe herbs. And it's just about the differentiation diagnosis, what makes it so special, because we can really work very individual to the patient. So if there is poor digestion, maybe some kind of cough, the patient feels very tired, having a hard time even in the morning to get out of the bed. Of course, the emotions are also very much influenced. Some people might feel depressed. All of these things can give us a clear information. Western medicine talks about the immune system. Chinese medicine is always talking about the qi, right? I don't want to compare the immune system with qi because it's a different concept, but let's take a look to this sentence over here. In Chinese, it's called 正气存内，血不可干. Okay, that was actually also a wrong pronunciation. So if we want to learn Chinese, we have to take very close attention and to focus on how we pronounce it. 正气存内，血不可干. Okay, that was correct right now. So you can see it's about the vital qi, about the healthy qi. And if this one is sufficient in the body, actually a pathogenic qi will not be able to harm our body. And if we take a look to this sentence, which comes from the Huangdi Neijing, the Yellow Emperor book, we can see that this is already grabbing the main part of Chinese medicine, because it's about taking care of our qi. So if patients are coming to the clinic, to your clinic mainly, probably they feel very tired, right? So what we have to do, and first we think about, oh yes, we have to tonify qi. Yes, but wait. So what happens if we have phlegm and dampness? Can we really only tonify qi? No, you cannot, because you have to be aware dampness and phlegm could increase, right? That's why we first have to transform dampness, transform phlegm, and then to slowly strengthening qi. But this is all hidden in this sentence in the inside, because it's about the sufficient vital qi. And this makes Chinese medicine so strong, because we not only have the way to strengthen the qi, to regulate it, to tonify, we can go very deep into the differential diagnosis and work very much individualized for our patients. And I think this is a good choice what people have once they're coming to your clinic. So we call this the recovery period, right? And people already have been through this kind of often very severe disease. And in China, mainly they categorize this recovery period into 3 different kind of categories. You have these in front of you. I'm sorry, and this is what we're gonna talk about in detail right now. We start with the lung and spleen qi deficiency. Yes, and in the beginning you can see always for Chinese people, if they are an acupuncturist or if they are prescribing herbs, they always stress out not to prescribe too many of these herbs and not to apply too many points, so to keep an overview. That's why it's very important to start to have a clear diagnosis, also for our mindset to be able to choose the correct points. We will in a second see different kind of examples, and then only to choose the most important ones, also to keep an overview, to be able also later on, for example, to change some points, because patients are also getting better, right? So you can have these main acupuncture points in front of you. These points are used in every category what we're gonna talk about today, right? Because they are the main points. Usually basic points you should all know. I usually call them in Chinese because I learned it. I learned it in Chinese character even, and it's very fascinating. If you have the wish also to step inside medical Mandarin, you will also open a new door, because you can see as once you get known to the Chinese characters, for example, Zu San Li is the stomach 36, right? So you already get a lot of information when you just look to the Chinese character. It's on the foot and it's 3 Cun in the inside, right? So stomach 36 is just a number. It's not wrong, but of course, if we want to step deeper also into acupuncture, sometimes the step inside the Chinese language is very much necessary. Okay, so you have these main acupuncture points over here: Neiguan, Zusanli, Zhongwan, Tianshu, and Qihai. And you can already see, yes, they are mainly all in connection with regulating qi, tonifying qi, about the lungs, about the spleen, because it's the lungs, right, who are taking care of everything what you breathe in to transport the water passages in your body. So there is no phlegm production if everything is working correctly. If you talk about the spleen, it should be transforming all of these important nutrients, what you usually eat during your daytime, to get simply enough of daily active energy, right? And then that might be, for example, patients are having cold limbs, cold feet, cold hands. So this might already be a sign of poor spleen functions, because the spleen is not able to transform these nutrients that starting from the middle, spleen and stomach, also our limbs, also our hands and feet are reached by these important nutrients. And it could be we have cold hands and cold feet. So this is also a sign. So mainly what you have over here, starting with Neiguan, you can already see, and I'm very sure you also use these points to calm the Shen. Shen is also the idea to calm down our mind. And of course, also when substances are missing, when body fluids are missing, I'm talking about yin deficiency, then of course our Shen is often disturbing or not combined in our body, and it can lead to insomnia, for example, or there is other things. Mainly treating nausea and vomiting. Neiguan over here. You can also go through these by yourself. Dusani, of course, an important point for tonifying qi and blood, and again, spleen and stomach is the center. So this is all what it's about. No matter if it's first transforming phlegm and dampness, you always have to put the focus on spleen and stomach, right? Zhongwan is the same, regulating spleen and stomach. And once you see these main acupuncture points, you might think, yeah, but this is what I'm already using in the clinic every day. And correct. And this is the beauty of Chinese medicine, because if we see patients from long COVID in the recovery period, we already mentioned they might have shortness of breath, maybe feeling very fatigued, very tired, poor appetite. So when you hear these key signs as a practitioner, you already should be thinking about, oh yeah, spleen deficiency. Oh yeah, there is lung deficiency. And you already are getting closer to your mindset. And this is also very important to have, because these three categories, right? We start now with the first one is lung and spleen Qi deficiency. Is giving you different kind of points as an example. But of course, in the clinic, it usually looks a little bit different, right? That's why we have to be very clear about the physiological functions of our internal organs. And sometimes it's necessary to review the TCM basics, you know. So what is the spleen important governing? What is the lung doing? We just have some symptoms over here, like shortness of breath, there is fatigue, nausea, abdominal tension, loose stool, and so on. So it's like a general weakness also. And on the left-hand side, you have lung points. On the right-hand side, you have spleen points. Also with, this is highlighted in blue. For example, if there is chest tightness and shortness of breath, we talk more about lung points, and you can add these additional points on top of it. Tanzhong, Feishu, and Zhongfu, right? You have Ren 17, this is bladder 13, and lung 1. Always, of course, also pay attention to the way of needling. It should be the subcutaneous insertion and Tanzhong, because it's a very gentle area on our chest. And the same for Zhongfu. Please also make this sure before applying them in the clinic. Of course, you are very clear with the needling technique. I know there is the acupuncture manual or other related textbook. I'm very sure this can also be looked up very clearly again. So if you look to the spleen points, of course, it's always in relation with weakness, right? Weakness, there is diarrhea, it could happen, nausea or vomiting, but for the spleen, it's mostly about the digestion. It's mostly to see, is it possible that, of course, the stomach digests the food and the spleen is helping to transform all of these nutrients. And once we have an imbalance, once we have weak spleen functions, of course, it's easy happening. We have diarrhea, and you have Shangwan and Yinling Quan for the additional treatment. And I give you two different kind of examples. Now, if you pay attention, we just go one slide back just for a second, if it's working. Yeah. So you see the tongue, it's pale and puffy, right? Sometimes we have like teeth marks on the side. It could be greasy coating. It could be white coating. So this is what you have in front of you, a quite puffy tongue on the left-hand side. You can see teeth marks, more obvious on the left-hand side. It could be even more obvious, this kind of spleen deficiency. And these are just two examples, of course. It doesn't have to be that pale. Sometimes the tongue is also slightly pale red, but having a very greasy or white coating. The second category, already talking about yin deficiency. So things are getting more severe, and there is more heat in the body. That's why the tongue is appearing more dry over here. It could be also with less or no coating, right? So this is already how you can differentiate different kind of symptoms, because people might complain about the same things. People also might complain about fatigue, poor digestion, general weakness, poor digestion, and so on. So we also have to differentiate. So what is now qi deficiency? What is yin deficiency? We ask about thirst, right? Are you thirsty? That's the first question. And then it's yes or no. And then what do you prefer? Warm drinks or cold drinks? So you get an idea. What is the internal state of the patient? Is he asking for warm drinks? So it means there is internal coldness. Or is the patient constantly trying to cool down him or herself and drinking a lot or preferring cold drinks? So we are more talking about yin deficiency with also less fluids. So this should be the first question, right? Is there thirst? If there is no thirst, then there is also in general no lack of fluids, right? You have palpitations, so there could be heat effusion, there could be dry cough. So these are just options. It doesn't have to be all in one example, right? Because clinical cases are usually mixed patterns. That's why it's quite important to see. Again, over here we have fatigue and shortness of breath in connection with the lung, of course, and Shenture, Ren 8. Of course, we don't needle this point, but we can use moxibustion. For example, if we have internal coldness, so the coating is more white or more greasy, very thick, greasy. You can also use a ginger slice and you add the moxibustion cone on top of it for warming the middle, opening channels, and also dispelling coldness. On the right-hand side, you have more severe yin deficiency, right? With dry mouth, this is kogan, koke in Chinese. Dry mouth and obvious thirst, right? So we really talk about yin deficiency. Then the tongue should be more red, actually, sometimes with less coating, sometimes also no coating. You have kidney 3, Tai Xi, and Yang Chi over here, which we add right to the main acupuncture points you saw in the beginning. So if you haven't copied them down, you will all for sure receive also a recording of this lecture to see these points again. We have more options, for example, palpitations in connection with the heart. I'm sorry. Xin and Jueyin Shu, the Shu back points at the bladder meridian, they are also used. And then, of course, we have to see, so we cannot needle on the back and on the front hand side together, right? So you have to decide, what are you treating? What kind of points are you choosing? Or is the patient sitting? Are they feeling comfortable or easy getting dizziness? All of these things we also have to consider. You see the pulse over here is very much in yin deficiency, which is a thin and also very weak pulse. Yeah, often you can feel it on the Chi position, which is the kidney position on the left wrist of the wrist, or on the right hand side as well. The pulse is very weak. Sometimes it's even very hard to feel it, and it could be very thin as well. Excessive sweating now is bringing inside some more excessive and external syndromes over here. That's why we apply Hegu, like large intestine 4, to expel wind and to release the exterior. And I think this is always really important. So you have different kind of choices next to the main points, because a clinical case of a patient is very seldom just according to what we find in the book, because it's a mixed pattern, right? Fulio and Susandi. Oh, no, wait. There is one more for insomnia. We also talked about this with Neguan, but also points like Shenmen, the Heart 7 or Yintang. Extra points can be used to calm the mind, to calm the heart, because this is also often happening when patients are seeking for an acupuncturist. They feel very tired, very fatigued, and it's a mixture. You can see dry mouth and thirst over here. We already talked about this with yin deficiency. Dry cough, right? So less phlegm also. So really like fluids are already missing. Also maybe because patients have been going through a longer period of fever. So usually in the recovery periods, it's about also to nourish body fluids. And if you start from spleen and the lung, you're starting at the center at the spleen, it's a very good direction then also to add all of these different kind of extra categories of points of what we mentioned it over here. Yongquan is at the foot located this point, and we also use it, for example, when we practice Qigong. You know, there is this kind of saying, Tianren He Yi, which means like the heaven and the man are in harmony if we also live according to the nature phenomena. And that's why we can also say when you practice Qigong, we focus, for example, on the highest point. This is the Bai Hui point, the highest point of the head, to make a connection with the heaven Qi. And we connect ourselves on the ground while standing with the Yongquan point to make a connection to the ground, to the earth, to have a very stable stand as well. And that's why I was mentioning it over here. If there are patients who are interested in learning Qigong, of course, this is also a possibility to give them some kind of self method. I'm sorry. Anmian Xue is also an external point. You find it in the midway between Yifeng and Fengzhi. Some points maybe you might be, you still have to look up in the book, but usually there are main points also what we talk about here today. Sorry, that was a little bit quick. So this is not the most accurate tongue picture because it could be even more red. You know, the tongue could be even more severe red with less coating. You can see the tooth marks on the side also showing spleen qi deficiency. So just imagine this a little bit more red is also correct. I didn't have a different picture, so I was using that one over here. And we're coming to the last category, is again lung and spleen qi deficiency plus we have phlegm and also blood stasis blocking the channels. Chest tightness is very important also over here because we still have a lot of phlegm and it's not being able to dispel the phlegm. So this is also blocking lung functions. That's why people might also speak, you know, a little bit slowly or more lazy. So this is the meaning of qi deficiency, because qi deficiency is also lowering down all of these functions, so bringing them into the general weakness. It's easy sweating, in Chinese called zihan. So this is always what we have to differentiate. If it's sweating at daytime without any kind of activity, so we usually also connect this with qi deficiency. A lot of people, they have night sweats, sometimes also very cold sweating, and they have to change their shirt, which is then more in the field of yang deficiency. Loss of appetite, right? It's also the loss of smell. We come to this at the very end with the 3 needle technique to increase the loss of, to increase the smelling functions. So over here we have loss of appetite. It's again spleen function, mental fatigue, of course, mental tiredness. This is also one part, like people being so isolated for so long time. Of course, we all have to do to take good self-support. over here you have the above symptoms, so you can add shoe points on the back. You have different kind of examples over here. And if it's more severe about cough, and we need to transform phlegm, we usually use Fonglong, you know, it's the stomach 40, which is also helping to dispel dampness and to transform phlegm. And this is what I mentioned in the beginning. So if we think about strengthening a patient's condition or the constitution, it's not only about tonifying, because if we tonify too early, pathogenic qi like phlegm or dampness would increase. So that's why we would have also to put this into our attention to first transform phlegm and dampness. And besides that, we can start to regulate qi functions, but not only, or for example, only adding a lot of tonifying herbs, you know, like huang qi or other herbs. That could be sometimes too much and then causing, for example, abdominal tension, there is bloating. So it means like it's too much of boosting the body because the body is not able to absorb this kind of energy. It's too heavy at that time. And this is also the theory, right? What we have to pay attention. So it's not only the meaning, we have to tonify qi, it's getting better, but sometimes transforming phlegm is also the meaning of strengthening qi. You can ask questions to that at the end. You can see the same images over here. What we don't have is blood stasis, because you can also ask the patient to turn around the tongue, you know, to take a look below the tongue to those two important vessels. If they appear a little bit more purple, you also have some information about blood status, such as also spots on the tongue, purple spots. Yeah. So you can mainly see that applying acupuncture, we had some points. You can even try to use moxibustion at the same time. And of course, there is more what people are also being able to do at home to be able to strengthen themselves. So in a minute, we talk a little bit more about moxibustion, tuina massage. There is some kind of emotional therapy, but in general, you can say that you would offer maybe a treatment twice a week. I know what we have over here, of course, if it's possible to treat the points once per day, and then we have to see, this is the condition in China, because people, they're willing to go to hospital every day. If your patient is coming every day, it might be even better for you, but it's, I think, not necessary, and sometimes also not really realistic. So usually we say twice a week, which is also okay, and you apply the needling also possible in connection with moxibustion. We'll now talk about some kind of self-applications over here, as I mentioned, also some kind of herbal plasters. I'm not sure if you have the access to buy some of these, but moxibustion, of course, is one part of acupuncture. Because when you already look to the name Zhenjiu, you know, this is the name for acupuncture and moxibustion. Zhen is the needle, or here we use acupuncture, and Jiu is Jiu is the application of moxibustion over here. So these are also main points. Of course, you can also apply these in the clinic, because I'm not sure on how familiar patients are about moxibustion and using these by themselves. It might be also a little bit disturbing for them because of the smoke. Some are not really feeling comfortable. So you might be asking them of not letting the smoke coming into their eye. It might be causing some kind of irritation. So there is also some kind of non-smoke moxibustion. It might be better maybe in your clinic. And you can see it's also providing a lot of regulating qi points like Zhu Sanli, tonifying qi, qi hai, another point for this one, and Guan Yuan, strengthening the yin, strengthening the qi. Again, San Yin Jiao, is strengthening blood and strengthening yin, I'm sorry, also especially for a lot of women. And over here we say apply moxibustion about 10 minutes. So that is the meaning if the patient is applying it for themselves. Some kind of heat plasters in China, they are quite common. We have some kind of treatment method over there, which is called Dongbing Xiazhi. That means we use the very hot summertime, and sometimes in Hangzhou or Shanghai, it could be to 44, 45 degrees. And so this is the highest peak of the yang during the summer. And we use it to treat winter disease, yeah? So also to treat coldness in the body. So this is just one example, but of course, heat or herbal plasters, they also could be applied on different kind of points. There are many different kinds of. So what we have in front of us is it's about warming the channels and opening blockages, right? So I don't want to recommend a special product over here because I'm not gonna do some kind of advertisement. So this is just some introduction about another method, what could be combined with the main acupuncture. Of course, if you know about Toina massage and you have the chance also to offer the patient a massage, also in connection with acupuncture, maybe afterwards, plus cupping, you know, the glass cupping. So this also could be a really good serial, and I'm very sure a lot of practitioners are already using it. So I was just writing down different kind of methods, such as pressing, rubbing, tapping, and then also I'm very sure you can help the patient to opening the channels, to relieve pain, to move the yang qi, and this is often also increasing the results of acupuncture if we combine it. Chinese Tai Chi or Qigong, of course, is another possibility if the patients are interested. What you have in front of you is I Jin Jing, Tai Chi, or Ba Duan Jin, Wu Qin Qi. It's the Wu Qin Qi is the game of 5 animals. I'm sorry. These are very modern Qigong techniques. They are mainly now broadcasted in China and taught in China, because you might know Qigong in China also didn't have such a good history, and after some time it also became forbidden. So after the government also decided what kind of Qigong styles are now, let's say, allowed to practice, so you also find these kind of examples. But of course, in our countries, you might even know about other Qigong styles. And of course, this is also helping, you know, calm the mind or helping to prevent from depression, from anxiety, strengthening the qi. So that's why it's also listed over here to promote main functions of the lung and of course of the whole body. Treating emotions is not a secret. That's when we talk about qi or yin deficiency. And we know that Chinese medicine, and this is what I was also writing my master thesis about, treating emotions by applying an emotional therapy plus on top with herbal medicine. This was my part, what I worked 1.5 years about it. And it's very interesting to really see that emotions are very clear connected with organ functions. So either you can treat the organs, therefore you can relieve the emotions, or you can of course directly work on emotions to benefit and to strengthen organ function. And this kind of connection, you also find it in the Neijing. For example, it's the liver, which is harmed by the anger emotion, right? And then there is joy, which is harming the heart. Considering or being worried for a longer time is considered to harm the spleen. And you have sadness or grief, which is weakening the lung functions. And you have fear, which is weakening the kidney. So this is Chinese medicine, Vedic theory. I'm sure you all heard about. What is important, I think, over here, is to understand that it's not the emotion which is harming the organ. So it's not correct to say that anger is harming the liver, but it's the pathological functions, what is happening to the body once we are angry, and if it's happening constantly. Also, we don't find any ways to reduce these kind of emotions. These normally physiological functions are turning into pathological functions, and they are actually harming our organ functions. So it means, for example, anger is in our body is leading the blood flow into the reversal flow, right? So if we have migraines or headache, it could be caused by internal imbalances in our emotions. It's also not right to say that joy is harming our heart, right? It's not correct to understand it like this, but it's more like to be overexcited. And then what is the meaning is also in the aging is that chi functions are slowing down. So it takes some time to get into this kind of thinking. There is another thing like being constantly worried and thinking in a circle, you know, it's like never getting out of this. And this kind of circle is also weakening our digestion, which is spleen and stomachs. That's why like being worried is weakening spleen functions. And we do have a way, which is the restriction therapy and the 5 elements. You can also take a look to that to constantly support your patients, to give them healthy emotions and to support them in these difficult times. You also have more information about here. At this point, I want to take the opportunity to introduce you to another special technique, which is called the Jin 3 needle technique. It covers 39 groups in general. 39 groups means we always have in one group 3 needles, what we use. Over here, I'm introducing you to the 3 nose needles because I believe it's about also to increasing the smell, that we can regain this kind of functions, because we also hear a lot of patients, they not only have poor appetite, but they also lose the sense of smelling food or smelling different kind of nutrients. And over here, you can see that the whole method comes from Guangzhou, China, from Professor Dr. Jin, and he was categorizing different kind of locations, such as the lower back or the knee or the elbow and so on, and telling, you have it in front of you right now. These are just some examples. There are 3 tongue points as well, 3 points for intelligence, 3 gastric points. Over here, you get the example of the 3 nose points, and you can see, of course, they are also in the region of the nose, and you have, for example, nasal obstruction. This also could be a reason of losing the sense of smell. And if you take a look to the first point, it's called Shang Ying Xiang, which we might not find in the book. So this is a special point over here he's using. You might know Yingxiang, the point. Let me just go one slide further. Yes, we have it over here. It's the large intestine 20, Yingxiang, but over here, the first point is Shang Yingxiang. Shang means on top, right? So the location is on top of Yingxiang, which is a very gentle area. So I'm also, it's very important also to know that needling at the nose for a lot of people also will be very painful. So this is just an idea and not sure if it's suitable for every patient. Of course, we have to communicate. There is a different name, Bi Tong. Bi is the meaning of nose, and Tong is like to make a pathway, so to open the nasal passages. That's the meaning of the point. So it's over here advised to needle downwards, and that's actually also the way when we needle through yin xiang, what you can have over here. It's welcoming the fragrance, translated as this. And this was my idea, to also give you this kind of opportunity to learn more about, maybe because once you will also have a patient who is complaining about the sense of smell, that there are some locations. So this also could be some kind of help. Well, the third point is yin tang. You also know this point, which is an extra point over here, not only calming the mind, but also over here used to open nasal passages, because this is all one area over here. And it also means that these 3 needles, they can be combined with other acupuncture points, which is no problem as well. So it doesn't mean that we only use those 3 needles. You can, if you work detailedly on one location, but of course, they also can be combined with other points. Yes, so over here, I'm just taking a look to my watch. Okay, we were just talking 50 minutes, so we have some more time left. Yeah, maybe we use this time for our discussion, for your questions. You're very welcome to use the chat to ask any kind of content related, but also if you are interested in, for example, in the China study, you would like to gain more information about the actual situation in China now. So feel very free to write down your questions in the chat, or what Ellen was also saying, of course, doing your hand sign and then opening the microphone. So I'm just giving now to Ellen, and yeah, I'm here the next 30 minutes for your question.
Fabulous. Thank you ever so much for
I think I forgot
really,
something.
really...
I'm sorry.
Oh yes, go ahead.
I think I forgot something, Ellen. I'm sorry. Just 2 minutes. I'm very sorry. This is another offer for you. Of course, you can contact me personally. I mean, if you have any kind of questions, if you would like to get in touch, of course, also if you would like to learn more about my local work, I have a lot of videos on my website. Some are in Chinese, some documentaries, but it's also giving you some kind of idea what my work in China is all about. Okay, I'm sorry, Ellen. I'm stopping now this slide share, and now it's you.
Grand, fabulous. I mean, thank you so much for that really comprehensive overview. Really lays out all of the options of treatment to us in patients with long COVID, and all of the aspects that we'll be exploring.
Yes.
Yeah. Now you've already had a compliment come in on the chat box. But so what you mentioned just at the end, that our members might be interested in, like, an update of how COVID is going in China. Perhaps that might be a great place to be starting.
Yes, like first of all, I think we have to see that that it's quite hard to compare China with any kind of European country, right? Either it's Great Britain or it's Germany. I'm now in Germany, because it's a different system behind it, right? So, but I'm constantly in contact also with doctors who are still working over there, and we can say actually that in China, life turned into normal already some time ago. That still means that people are wearing masks, for example, if they attend a class, if they go into public services such as railways or underground subway, a restaurant. So they do keep wearing their mask. And for sure, in many public places, once, for example, you are entering a shopping mall, they will do these temperature checks for sure. This will still be there, but in general, the condition is more relaxed and not that tense than it has been going on in the past. Now, from time to time, we can hear that in some cities, they might have like 1 new case or 2 or 3 other cases. And then, of course, the media, they are using, of course, this chance to, yeah, to write about. But what I experience right now is that at the moment, it's more Europe and, of course, the US and other countries who have more difficulties than China, who might already had passed the peak of COVID-19.
Quite very different picture to what we're seeing in the UK at the moment. And I imagine, I mean, you were giving us some updates before we went live on the situation in Hamburg as well. Very different pictures going on across the locations. There's been quite a similar question already crop up in our chat box here, on the topic of the handling of COVID-19 in China versus in the West. So this question points out that Western medicine treatment is for symptomatic relief only in particular, and the priority is really to avoid transmission of the disease to other people. She says we stay at home with mild or moderate cases, hospitalization if severe. I'm wondering if people are treated with Chinese medicine diagnosis, etc., but with PPE when they have acute COVID infection in China.
Yes, they do have it. And then they also do this integrate approach, mostly applying herbal medicine. There are some also which are treated by acupuncture. That's why today the lecture we talked about acupuncture, which is a good choice to help, especially in the recovery period, because people are they are already through this severe time of being ill, and now it's about to strengthening the qi. But when it's in China, it's mainly about herbal medicine. And there are a lot of reports and texts available talking about different kind of herbal medications, different kind of formulas. And then once again, what is always the strength is the differential diagnosis, right? So I was also giving a lecture about the treatment of COVID-19 using Chinese herbs. And you can say the essence about it is that it's mainly about coldness, plus on top dampness and phlegm. Of course, today we also talked about yin deficiency, and there might be also people who have more signs of heat, of deficient heat. This is not wrong, but the main direction is for sure in relation with dampness and phlegm. And of course, if we have the possibility to apply herbs, this is also a very well-known choice. So in China, they have these treatment cases where people are treated with Chinese herbs. And we had in Germany the opportunity to invite Chinese medicine doctors online from famous Shanghai university hospitals, and they were telling about their treatment experience. And they were telling mostly about herbal medicine cases where people have been treated and also succeeded in their treatment, where people recovered and often recovered in a more quick way, in a more holistic way, because as we know, we can work more on the individual basis, right? Yeah.
And on that kind of note, in China, I'm curious because I've personally heard differing accounts of long COVID treatment in China, or long COVID prevalence in China, as it were. Do you have any observations about how the sort of rates of long COVID, or the way that people are using Chinese medicine treatments to perhaps avoid them? To avoid falling into long COVID and becoming a so-called long hauler, as it were.
Yes, they also recommend different kind of formulas. I can try to find that PowerPoint as well, and I can share it also, that some parts of it, because that's also very interesting. Because as I mentioned also in the lecture, it's not only about that we should now all tonify our qi, so we have more of it. So that's not the meaning. That's a Western approach, actually. And if we take a clear look, we would also not strengthen our immune system by only boosting it, because it would get lazy, right? We would more ask our immune system to be to working heavier, so to getting stronger, and then being able to build up a better constitution. And in Chinese medicine, it's the same. So it could be, for example, that we try to avoid, for example, in our nutrition, not eating too much of greasy food, not eating too much of raw food or cold food. It doesn't mean out of the fridge, which is cold, but temperature cold related. So because this is also harming our body, right? Because it's very hard to digestion. And if we are already in a weak constitution, it's very easy to produce phlegm or dampness. And this might be the next risk, to be able, not to be able to have, to have the chance maybe to get an infection easier than a person who is more balanced and who's also, for example, taking care of nutrition. And this is what we all can do in our daily life. So if we see like it's more in relation with coldness and dampness, so we can just try to avoid to eat too much of cold food and too much of, producing greasy, like cheese or milk and all of these things, even though they are very nice. But we also know they are, of course, weakening spleen functions. They're not only cold, but also very greasy. And I think during this time, this is what we can actively do, besides, getting into easy sports to increase our strengths. And yeah, of course, also taking some kind of herbs. If we have, for example, a sore throat, and we know about, this is another thing, if we learn about different kind of tastes, we have these 5 tastes, like sour and sweet, spicy, bitter, and salty. And we know that this is the essence also of herbal medicine, because the tastes simply have a function. And if we know, if we bite in a chili pepper because it's spicy, we start sweating. So we know spicy taste is moving our processes in the body. It's also opening the exterior. So if we next time maybe have signs of a common cold, we can work with ginger, what we all probably have in our kitchen, and using some spicy herbs. And so this is the way when we talk about Yangshan, and we can really be active and be part of it. So I'm very sure we can prevent in a very good way, a very holistic way. Yes.
Absolutely brilliant. Now we do have a couple of questions which have already stacked up in our chat box. Now, the first of these questions is regarding restriction therapy, and I'm not sure if this was a term which I may have missed, which was in your slides.
Yeah.
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 Exactly. So she asked if we have kind of a bit more explanation about restriction therapy and how this this is used in emotion.
Sure. Yes. So if you have the 5 elements in front of you, it's the wood and the fire, the earth, the metal, and the water, right? You can all open a book and you have an example, so it's easier to follow. So then the first thing is, what are these elements actually? So I find it easier to talk about a quality, it's the quality of wood, it's the quality of the earth, because the quality of wood is actually rising. So it's a rising quality. If you now combine this 5 element theory with the emotions, you can also see the emotion of anger is also something which is rising in our body. And it not only turns the blood into the reversal flow, but it rises also other processes. So people, maybe they get like red eyes, migraines, headache. And so if you connect that with the wood element, just to make an example, and you have the spleen, right? So you often have the case that the spleen is attacked by the liver, right? So it has to be that the spleen is quite weak, and it's easy for the liver to be dominating, and then it's easy also to harm this the spleen organ, because there is a connection, right? If you have the 5 elements in front of you, so you have this option that the liver is harming the spleen. Okay, so now if you take that into the restriction therapy, that means to work on emotion. That also means that anger can control over worried or constantly thinking, like this kind of state of mind. So that sounds really strange. So we can use anger to treat a state of mind, which is a patient, for example, who's constantly worried or overthinking all of these things in his life. So we have to get back to the quality again. So we can say that anger is something which is rising, right? Because it's the wood element. The spleen is in connection with, I already talked about this, if we constantly think in circles, so it's some kind of accumulation process. And if you want to treat some kind of accumulation process, you need a rising energy. So that's the idea, right? So that also means, for example, an example from daily life, if you constantly usually think about something, consider, worry a lot, you don't find any answer, it's about to first take action, to do something, and then afterwards to think about. So that's the idea, that we use emotions to treat. That's the idea of the restriction therapy, that there is always an organ. Another example is joy can treat grief, right? I mean, it's very easy to understand that if a patient is sad, you can tell him or her, yeah, just be happy. It's easy to say so. Often they are not able because they feel depressed. But important is that we understand the principle behind it. Yeah. Shall we go deeper into that, or that's really a big world?
I mean, the first thought that comes to my head is when we're talking about working with that emotion. So in the example of the fire metal association, when we're discussing joy, are you referring to your dynamics, your interpersonal dynamics, or are you referring to particular acupuncture techniques?
Not particular acupuncture techniques. It's more like a psychological method, and we can also combine it with herbal medicine, for example. If we take again the liver and the spleen, this kind of connection. So it's the liver attacking the spleen because the spleen is weak. We have poor digestion, we have abdominal bloating. We also have a lot of worried, which is the emotional part. Sometimes we have a lot of stress, which is the liver, you know, this kind of anger, a lot of, and then it's easy to harm spleen functions. So what we, if we make it like a consultation therapy, if we talk with the patient on how to be able to strengthen spleen functions, it's about to leave this kind of circle, right? This is our goal. How can we leave this kind of circle of always constantly considering about things? And that's what I mentioned is then it's the function of the liver, because it's a rising quality. So you can probably recommend your patient, you know, just try something different, what you never had in your life, to avoid constantly overthink something. Plus, on top of it, of course, you can strengthen the spleen organ with Chinese herbs. You can smooth down liver functions to regain this balance between those two organs. And this is the meaning, to combine an emotional therapy with, at that time, I was writing my master thesis about herbs. So this method is not particular about acupuncture. I don't know if my explanation were clear enough. I'm not sure.
No, that's absolutely is absolutely spectacular what you've just described, and I'm sure it's something which we could spend hours.
Oh, it is.
Absolutely.
But you find, like, you find it if you have a book and which is talking about the 5 elements, which is a basic Chinese medicine theory, right? So there is also the part of, for example, the 5 elements, they combine different kind of locations of the body, then different kind of seasons, and of course also the emotions. You can also look in the Neijing. It's also written inside there, for example, you know, that anger is harming the liver, what I was already explaining, or it's grief harming the lungs. I give you another example about that one. That's also easy to understand. And we imagine, for example, a couple who is constantly fighting in front of their children. So children are constantly listening to their parents and of course becoming very sad. That's why also they might also more often develop some kind of asthma, common coldness, some kind of new dermatitis, and sometimes we don't have a reason what could, no, sorry, sometimes we don't see a connection, what could be the reason, but it could be the emotion of grief, which is simply weakening lung functions and therefore enabling a disease to start, like asthma or so on. So this is also a direct factor in Chinese medicine, that they say an emotion is a direct influence uh, starting from the inside, that it could harm our organ functions, and we can turn that around. We can also heal through emotions. I mean, we have many different kind of emotional ways of healing, and we also do have this in Chinese medicine. I don't want to mention now scholars or names, but you can Google this, and you find many different kind of transforming emotions also. It's a big field and very interesting. And my last sentence, I do believe very suitable for Westerners, because we always are interested to be part of the treatment, which is different in China. And that was my pain, actually, to collect treatment cases of Chinese patients, because they're usually not talking out loud their behavior and their emotions on how they feel. But I think for Western people, it's really suitable, because we like to think about it and to be, yeah, involved in it, to be part, actually.
Really, really, really fascinating. All of these aspects. I'll move on to another question.
Penny, I see Penny, she was lifting her arm. She's already waiting.
Oh,
there.
yes. Grand.
Yeah.
So Penny, feel free to take yourself off mute if you had anything to add to the question that you asked about restriction therapy. If you're able to take yourself off mute, I'll just have
I'm off mute now. So thank you, Tim. Yeah, I just wanted clarification, and I think simplistically what you are bringing is that you're using the Ke cycle to
exactly.
try to treat,
yeah, 相克, yeah. Ke.
or stagnated emotions or emotions that are out of balance. So yeah, so thank you.
Yes, exactly. Just wait a second. Exactly. You find it at the, they say 相生, right? This is the generating, and 相克, this is the restriction. This is what you find, the explanation of what kind of organs are harming other organs, which kind of emotion can harm another one. And then on top of it, we can also have a treatment method. To use a healthy emotion and to balance this kind of weak emotion. So this is also, yeah. Then it's not the Ke element, the Ke cycle anymore, but it's what you mentioned exactly. You find the theory over there. Yes, the basics. Yeah. Yes, sure.
Thank you.
grand, fabulous. I'll move on to Stephen's question here. He says, in your experience, is there an element of retained pathogen in COVID which isn't just phlegm?
Can you say again?
In your experience, is there an element of retained pathogen in long COVID which isn't just phlegm? Are there elements of retained pathogen of the other pathogenic influences, heat, cold, damp. I mean,
Oh, yes,
we've
of
mentioned
course.
cold, damp, and wind, of
Of
course.
course, yes. And this is what we should not forget, even though we were listening to this lecture right now, and I was introducing the main categories, which I believe, which is the main direction. But of course, we are all individuals, and it could be that we have yin deficiency, you know, with internal heat, which is not in relation with the typical category of coldness and phlegm. We also talked about blood stasis. I was maybe not introducing so much about it, but this is also possible, simply because if chi flow is stagnated, the next stage could be there is also blood stagnation. Yes, of course. Even damp heat, because it's in connection with heat, right? And then it could go into the cold or into the heat direction. And this is also what I'm trying to avoid, you know, to put you in a special direction, but then maybe in the clinic you see something very different. And of course, this is possible. Yes. So the lecture today was introducing you about the main part, about spleen and about spleen and the lung, plus on top dampness and phlegm. But of course, we could have heat phlegm, you know, also, and deficiency types in yin or yang, of course, yes.
Grand. I mean, often
that's why differential diagnosis, tongue and pulse, is always mandatory. It's always important to take, not just to take the symptoms like there is cough and weakness and poor digestion, and we start treating. So this would be Western medicine style. Then it might also work maybe for 6 or 7 patients out of 10, but there are for sure 3 or 4 patients which are not getting better. And of course, we have to work on the pulse and the tongue. And yes, again, it could be also more in relation with heat. Yeah.
Quite.
Yeah.
Quite. I mean, it can sometimes pose a bit of a conflict when you observe the remnant effects of a pathogenic influence, can't it? Say, for example, in patients with cold, but in whom you're observing yin deficiency, dampness and yin deficiency being a very difficult balance to strike. I'm curious if you have any inputs about the process of managing contradictory elements of somebody's diagnosis.
Yes, that's always very interesting. And we can go back to our Chinese medicine basic theory, because we have it over there. We have the introduction about treatment principles. For example, if we have dampness and phlegm, we do not tonify, right? We first reduce, we first release the pathogenic qi, and afterwards we tonify. So we have this kind of biaoben. Maybe you also know about that one. We can treat the root. We can also treat the surface. Sometimes we can have it in both ways. And yeah, once again, it's much, how to say, it makes also, I'm sorry, it's always about herbal medicine, you know, because when you work with patients, you have to, for example, to transform phlegm, to release dampness, and at the same time, you are starting to regulate qi, to strengthen the qi, but you can limit this kind of amount simply through the amount of the herbs, of how much of gram you prescribe. So maybe it's not 3 or 6 grams, but you maybe give 20 grams if you want to tonify. But if you don't want to put the tonification on top one, you can always play with the amount of the herbs. Now for acupuncture, we don't have to forget that it's not just to insert the needle, because we also have De Qi, right? In China, De Qi, like to reach the Qi, there are many different kind of techniques, and then it depends on the doctor on how much they emphasize these different kind of needle techniques. And we can choose if we want to tonify one point and we use the same point, but we more want to release energy. So this is also one point that we have to work on our needle manipulation if we use acupuncture. In herbs, you work then through different kind of amounts of how you prescribe, and you can combine. If you want to treat this, I always use this biaoben, you want to treat the surface and the root at the same time. We should have this in our Chinese medicine books. Well, in China, it's like this. And yeah.
Yeah, absolutely. And we do have a question on needle technique, specifically regarding the three nose technique that you mentioned, and what kind of needle technique you are using on those points.
I don't think any kind of needle technique. It's simply a very gentle way of inserting, because it's very painful. That's why I was introducing this method over here, but it's a very gentle area over here. And if we still, of course, have some kind of inflammation, we also have to watch out, for example, to use the Shang Yingxiang, which is a little bit higher. It might be very painful for some patients. This is what I saw, and I was shocked. So we have to be aware that if we add some extra manipulation, this is not suitable to do it at the nose. So it would be just simply inserting the needle and leaving it. The same for yin tang also. It's very gentle, because in other philosophy, we call it the third eye, right? Or it's the upper dantian. So we would not apply a strong manipulation on these locations, because we want to calm the mind, to calm the Shen. And the stronger we work with the needle, the more we are moving on in this part. So it's not good to work in the face with needle manipulation too much. It's different if we work on the limbs or on the abdomen. It can be stronger and also better to adjust for the patient.
Quite. And how long would you be leaving these in place?
It can be. It also can be around like 30 minutes, such as you do the normal acupuncture treatment, and you just add these points. For example, if there is a loss of smell, loss of fragrancy, you can simply add these points. If you're not comfortable with the upper Shang Yingxiang, you can also try Yingxiang and Yin Tang, also okay. So we can be very flexible. 30 minutes, 20 to 30 minutes, it's all fine, but no needle manipulation on these points. Yeah.
Yeah, grand.
That's too much.
Yeah, quite. It's all sounding very familiar, delicate areas and such.
Yes, it is, yeah.
Now we have a follow-up question. Earlier we were asking about the treatment of acute COVID in China. And I'm just having a read through this question from Vina once again. So
hi, sorry, Alan, can I just clarify, my early question wasn't just about acute COVID. It's about, like, for my understanding, which I think, thank you, Tim, you did answer about, but it's also just about even a mild testing positive for the disease. So whether it's sort of mild or moderate, but not acute and necessarily requiring hospitalization for oxygen or ventilation, which is what we're really familiar with over here. But if somebody has the diagnosis in China and they are relatively mild version of it, what I'm wondering is whether, as you've said, Tim, is that, you know, it's acknowledged and in a Chinese medicine diagnosis format, whether, and people may be receiving herbs, as you said, do they also need to be self-isolated or just restricted movements to prevent transmission? But also the second question that I had is that if people in China are actually being treated for the disease to strengthen, you know, their qi against the disease, etc., and the effects internally of the disease while they have it, do you think, or is there evidence that there is less incidence of long COVID? Because it seems to me that the fact that over here in the West, because we don't treat the disease itself, the patient is left with their own internal strengths to cope with the disease, and then may end up with more long COVID in the West. That's my essential question. And we, like the herbalists over here, especially, are in a relatively good position to be able to treat remotely, but acupuncturists, we have this difficulty of face-to-face treatment. So yeah, I don't know if that's clear,
Yeah.
my question.
Yes, thanks. First of all, we have to keep in mind that Chinese medicine is not treating the disease, right? Chinese medicine is treating the syndromes. So of course, also it's possible to treat mild syndromes. If we start to do a differential diagnosis to offer acupuncture, in China, it would be the first choice, it would be with herbs. And if we go along according to the differential diagnosis, of course, this is also possible. And it would be very similar, also keeping the spleen and the lung at the center, and then to see if it's on top of it, for example, important to release heat. So then you would treat COVID-19 if you would treat this kind of patients according to the syndromes. Because we don't treat the disease, right? We treat,
yeah.
I think, yeah. This is one thing. I also,
but I think, sorry, I see what you're saying. Like, I mean, the way I phrased it, but what I meant was that the person is actually getting treatment, given that they have, acquired COVID-19. So it is, specific to the person. So we're not focusing on the disease. But my point really was the fact that they are actually getting treatment rather than, in a way, just dealing with symptoms. Like over here, it's keep hydrated, painkillers, etc.
Not everyone is getting a Chinese medical treatment. I think not everyone. I think the cases what have been presented from Chinese doctors, they come from certain hospitals where they do have the chance, because it's also always a question of the government, I'm very sure, what kind of patients are allowed to be treated in which kind of hospital, if it's allowed to use Chinese herbs. So we should not have the idea that every patient in China is treated with Chinese herbs. That's not like this. No.
Right.
No. A lot of people, they also, if they get tested positive, they will be isolated very clearly, very quick. And we also saw this from Wuhan, that they are able to lock down the whole city without any kind of problems. And this is also still happening when they find a new infections and they lock down the whole neighborhood. So this is happening quite quick in China, or they lock down the whole street. Also the street where I was living, also the opposite side, there is a pedestrian precinct. It's completely closed. It's not possible to go through anymore. And all the shop owners, they can give up their own business. But it's not that we have to think that in China, every patient has the chance to get Chinese herbs. No, I don't think so.
Right. Okay.
What they presented to us is we were inviting doctors from big hospitals in Shanghai, and they were sharing their experience in the treatment of their patient. And it was in connection with Chinese medicine, and that was very interesting. And I can check if I have something to share more, some slides with you, but at the moment I don't, I'm sorry. Yeah.
Thanks very much as well.
Yes,
but
sure.
also just, you did refer to a link for some research around that. So I'm just wondering, Alan, if we could have that.
Yeah. Oh yeah, definitely.
Well.
Yes.
Yeah.
Yes.
Thank you
just
very
checking
much.
something which is in English. Yeah. Just I
Thank
write it
you.
down. Yeah, sure. It's really interesting. Yeah. Good.
Brilliant.
Okay.
And thank you for that really interesting question, Lina.
Yeah. Yeah.
So
sorry, just I mean, I suppose we just don't have the information, Tim, but what would you guess would be a situation that, say, in an ideal world, if people had access to good treatment for if they tested, acquired the disease, say with herbs and acupuncture, do you think there may be less incidence of long COVID? Because that's the big thing that's happening over here. I mean, we hear it like even people who have no idea about Chinese medicine, just in the media over here.
Exactly.
And there are long COVID support groups on the internet and things,
Exactly.
but people are really lost as to how to cope with it.
Yes. It would be the same in Germany over here. I personally do believe, because we are closer to the person, we are closer to the patient, simply because we can work on a very individual base. If there is dampness, for example, Western medicine has no explanation about it. Why, for example, why people after being ill for so serious and they still haven't recovered yet, there is still some chronic cough or fatigue. Chinese medicine has an explanation, and I'm personally, I do believe very clearly we can get better also in a quicker way. Yes, I do believe. And also to prevent that the disease is getting into a very severe stage.
Yeah.
So also to lower down the symptoms. For example, if you have heat effusion, you have many different kind of herbs you can work on. That doesn't mean that we treat the virus, right? We are not talking about this. We don't treat bacteria or viruses, but we can treat, for example, heat effusion in the stomach, or there is wind heat. We can expel wind and so on. And because we have this rich choice, I do believe people really could benefit from it. Yes, of course.
Yeah. Thank you.
Yes, of course. Yes, sure. You're welcome.
Grand. Now I'm very conscious of time and how we've kept you, but questions are still coming in. And I was just aware that at the start of your talk as well, you mentioned a way for people to get in touch with you directly. I wondered if perhaps if you would share your screen so people could just familiarize themselves with that again, if that's easy to do.
Of course, if you allow me, yes, of course.
Because
yes,
I mean,
sure.
I'm sure we could go on all nights with so many questions.
Very nice.
We'll just continue to.
Sure. Okay, I'm sharing right now. This is my web browser. This is my website. It's the English version of Wushan TCM. Wushan is a mountain area in Hangzhou. I was living there for more than 10 years, and local people are still practicing Qigong and Tai Chi in the morning. And if you go there, you also find a lot of herbal stores over there. So what I'm doing actually over here is I'm offering online courses, and I want to find, we have it over here. It's the concept about, no, it's not this one. Because I was doing, it's a free course about the Chinese medicine treatment of COVID-19. Just have to find it. Yeah, it's over here, the Chinese medicine treatment concept of COVID-19. So I'm going to give you the link. I hope it works. I can put this in the chat if it's okay.
Yes, absolutely. Fantastic
resource for everyone. So this is just an example of a Malaysian doctor. She was my classmate in Hangzhou when we started in 2005. She had the advantage because she knew Chinese. I didn't, but we did the undergraduate and the master together, and she's also now already finished her PhD in Beijing, and she did a lot of research about this COVID-19 and the Chinese medicine treatment. And you find this lecture, it's 2 hours in total in English and in Chinese, and you find more information about the herbal treatment, for example. We also have cases in the inside, examples of tongues, then different kind of differentiation types. And yeah, I think this is also one possibility to learn more about it. And one more time, of course, always feel free to contact me. Yes.
Brilliant, fabulous. So on that line, I mean, we've kind of given you that the challenge. We've said long COVID. We've given you an hour and said, tell us everything there is to know about long COVID, and you've done such a tremendous job in doing so. Thank you ever so much. And on behalf of the British Acupuncture Council, thank you so much for giving all your time and energy to preparing this talk and delivering it in the enthusiastic way that you have. Thank you ever so much.
Thanks. Okay. And also thank everyone for joining, for taking the time. Yes, I'm happy to share a lot, which is for sure I'm not sharing everything over here. This is one part. And if we start to, to also discover more what comes from China, there is so many reports and essays and texts, but I just hope you enjoyed this. You can have something from this lecture. It's helping you, and also wish everyone all the best. Keep healthy. Thank you one more time.